This week, we have a busy agenda, and I want to share. This morning, I staff a internal medicine clinic intermittently, and so this morning I stopped in to staff one person, 72-year-old man, and the question was, did he have mild age-related cognitive changes? Was this mild cognitive impairment, or did he have dementia? And that's kind of the spectrum we're dealing with. And today we really want to get a sense of what age-related cognitive impairment looks like. And what are its features and what parts of the brain are involved in it. So we're going to start off briefly review. Those of you who don't remember everything I said last week, I'm going to just briefly overview it for you. Then we're going to get into some good news. And then a little bit about pattern of aging changes of cognition. And do these things we've talked about cause this? And do we have data? Is aging a disease? And can we measure our biological age? I start off with this picture. This is perfect because this is the way, you see a doctor and you have memory complaints, and depending on who you see, they're interested in different things. So the internist is scratching his head. He checks your B12 and TSH, your thyroid functions. And, he's got every patient 6 minutes, so it's tough. You see your psychiatrist, and he's worried about your insight and what are you thinking clearly, your thought processes. What's your mood? Are you just depressed? The neurologist, we're analytical, see? So we're thinking about visual, spatial skills and memory systems and language. But all of those things play into understanding and evaluating memory disorders. And what we're going to do today is we're going to look at it from a kind of a clinical perspective. I've spent most of my life walking in the room and saying hello and sitting down and trying to assess cognitive performance in a person, and I have 25 minutes to get through that clinical part of this. And so I'm going to share with you some clinical tools and some things looking at cognitive performance in normal aging adults. And this is a better than normal group. So I'll show you some of those things today. The good news is the cognitive changes with aging are generally subtle. Most people's aging changes aren't dramatic. They're confined to a few subsets of cognitive function. So it isn't like you go to hell in a handbasket, pardon me. Most people have subtle changes in their cognitive function. Secondly, some cognitive functions are actually better with aging. And I think most importantly, I think emotionally, older people are a hell of a lot better than younger people. I think they tend to be happier, they tend to be more engaged, they're not as uptight and fretful. So aging has some real benefits. And thirdly, these changes I'm going to talk about today don't restrict most normal older adults from doing the things we do, shopping, cooking, playing canasta, whatever we do. These things don't age. So that's good news.